You're listening to a podcast of Health Talk with Dr. Ronald Hoffman from WOR 710 HD, New York. Log on to WOR710.com for more information.
Welcome to Health Talk. Dr. Ronald Hoffman here. A special focus subject tonight because we're going to take on a very controversial area in medicine. Tonight's guest is one of America's most innovative yet controversial physicians. The way that he came to my attention is that many years ago in the 1980s, New York Magazine ran an investigative report on back therapies. Apparently, the investigative journalist who was looking into various forms of back therapy had back problems, and he visited a variety of therapists to be found within Manhattan. And he tried a little bit of this. He went to a conventional doctor. He went to alternative practitioners such as acupuncturists, chiropractors. He did Tai Chi. He did Feldenkrais. And he rated the various therapies and basically came to the conclusion that these therapies helped him in various ways, but none of them completely conquered his back problem. But he was somewhat satisfied that at least he was coping with his back problem. A few months later, to my amazement, the cover of New York Magazine was adorned with a bold headline that said, "The answer to back pain," with an exclamation point. And in it, the author divulged that he had discovered a paradigm that completely abolished his back problems. And I read on with fascination. And that's where tonight's guest comes in, because at the time, he had just written a book called Healing Back Pain. And it was a book that revolutionized the world of pain treatment and really set the medical establishment on its ears, got people arguing, created great controversy, and now he's written a great new book called The Divided Mind. And this stuff is very important for you to hear. He is, of course, Dr. John Sarno, world famous as a guy who treats back pain, not with surgery, not with manipulation, injections, but he treats it via a unique mind-body therapy. So it's a great pleasure having you on the program, Dr. Sarno.
Yes, thank you. Good evening.
And I'll additionally mention that Dr. Sarno continues to be a professor of rehabilitation medicine at the New York University School of Medicine right here in Manhattan. He has been practicing medicine since 1950, which is a little bit that's a little before I went to medical school. I wasn't practicing. That was before I was practicing anything. And you were in medicine.
Yeah, I graduated that year.
Okay. So tell us a little bit about how you came to believe that the vast panoply of medicine, the surgery, all the therapies, the physical therapy, the injections, the drugs, really were the wrong way to go in terms of treating back problems.
Yeah, well, you see, it's not really a question of a therapeutic approach. The answer to this is based in the question of diagnosis, not approach. In other words, after working with the usual diagnostic methods and therapeutic techniques for a number of years, I started doing this in 1965 when Dr. Rusk at the famous Rusk Institute asked me to come to the Institute as the head of the outpatient department. And I was confronted with these large number of people with pain, yes, back pain. Actually, these days, I see people with pain in the back, the neck, the shoulders, the arms. It's really musculoskeletal pain. You can have it anywhere.
And you have seen literally thousands and thousands of patients in your medical career.
If you look at the simple numbers, I think since about 1980, I've seen about 500 new patients a year. And so you can see what that adds up to. Actually, it even goes back further than that. At any rate, it's a question of diagnosis, not treatment. The treatment follows the diagnosis. And what's the diagnosis? That these very real pain things, and that's the thing that one has to make absolutely clear, this is real physical pain, is actually initiated by the brain in an attempt to protect people from feelings that are inside and that the brain considers to be very painful, very dangerous, and things of that sort.
Now, ordinarily, when you say that, a lot of people would say, well, Dr. Sarno is accusing us of malingering, of making up symptoms, of trying to get out of, say, work or get on disability or something like that.
From the truth. In all the years that I've been doing this work, I think I can't remember one single person who was truly a malingerer. And so that really isn't in the picture at all. These are people that have had pain in these various locations, and as you mentioned a moment ago, the reporter from New York Magazine had been everywhere and tried everything. Indeed, most of the people that I see these days still have been everywhere and tried everything before somehow or other they've come into contact with this idea. Writing a number of books on the subject has been helpful because people will get to see them, or friends will say, I think you ought to read this and take a look at it, and so on. So a lot of people can be exposed to the idea. No, these are real physical symptoms, and they're based, as I said, on, to make it, very simple, stresses and strains in our lives. And these stresses and strains can produce internal reactions that the brain considers to be, very painful or even very dangerous, like intense anger, for example. I think that's one of the most important things, that we very often are being protected from the intense anger that we have at an unconscious level.
So you're saying that the body creates pain almost to distract us from something that would be more difficult to experience, an experience of tremendous fear or helplessness that may be very primal or childish in
You
origin.
put it very well. That's exactly what happens.
And so this is actually a type of theory that harkens back to Sigmund Freud, that we block experiences, that we keep them in our unconscious.
Well, yes. One of the interesting things is that, yes, Freud introduced the world of medicine to the unconscious, and indeed he pointed out that many things are repressed and kept in the unconscious. But paradoxically, when confronted with this particular disorder, which he described many, many years ago, on 2 different occasions in the medical literature, he said, no, that's not caused by the brain, that's organic. However, I think the brain is using it for psychological purposes. But even the great Freud, was not aware that these pains are literally brought on by the brain, yes.
Okay, now what if a patient comes to you, as they often do, bearing MRI in hand,
right,
that shows clear-cut evidence,
right,
of a disc herniation,
right,
or some sort of spinal malformation, and they point to it and they say, Doc, this is where they say my nerve is being pinched here,
yes,
I need an operation. Isn't that a clear-cut evidence that the problem is not in the brain, that it's organic, that it's physical, there's actually a cause?
Well, first I should tell you that at least 75% of the people I've seen over these years have come to me with MRIs like that, or X-rays. I started this before MRIs existed.
So it would seem it would be impossible to make them better.
Yeah, but
without...
you see, here's the rub, as our friend Shakespeare said. These structural abnormalities are real, and they are there, but they are not the cause of the pain. This is an enormous misconception in medicine. It is assumed by all the doctors that a herniated disc must be the cause of the pain. Well, I will tell you, Doc, you and I are both physicians. There is no evidence in the medical literature that this is so.
Well, actually, I will echo what you say, because there have been studies where they've given radiologists MRIs of either sufferers of back pain or non-sufferers of back pain, and they've blinded the radiologist to the actual condition of the patient.
Right.
And so they'll pick up a MRI and they'll say, well, this guy is obviously going to be in a lot of pain. I can see it because they have this, this, and this. And then it turns out that the patient is fine, does not have any symptoms at all, and vice versa sometimes.
Well, exactly. And in 1996, a paper was published by a doctor named Maureen Jensen and her colleagues, in which they did MRIs on, I think it was something like 98 patients who had never had back pain in their lives. And she found that only 36% of them had normal discs. the rest of them.
So in other words, if you look for a culprit lesion causing the pain, you will find it even if there's no pain.
Exactly.
All right. Important point. Can you hold that thought? Because
Sure.
we need to get to a break. When we come back, we'll examine further this very controversial notion that we needn't cut nor medicate nor therapeutize nor acupuncture. What we need to do is we need to investigate the source of the problem, which is the mind itself when it comes to a vast array of pain syndromes. That's the message of Dr. John Sarno in his new book, The Divided Mind. I'm Dr. Ronald Hoffman, and this is Health Talk. Back to Health Talk. I'm Dr. Ronald Hoffman. We're talking tonight to Dr. John Sarno. He's an establishment doctor who works in a mainstream rehabilitation hospital, one of the finest in the country, part of New York University here in Manhattan at the Rusk Institute. And his contention is that back surgery, medication for back problems, even alternative therapies like chiropractic, acupuncture, massage, various healing modalities of this kind make absolutely no difference when it comes to healing back pain, and that the key is the mind-body connection. Dr. Sarno, can you illustrate this principle with some cases that you've seen? I mean, there are literally hundreds of cases that you describe in your books, but just give us some examples.
Well, I mean, it's so common and it's so universal that it's, and I see them every day. Someone who comes in with a typical backstory, and back pain that they've had for a while, and it's questioning the patient about what's going on in their lives, and even more important, of how they function. For example, everybody has stresses and strains in his life, and what I find in the vast majority of people that I see is that they tend to expect a great deal of themselves and to put themselves under pressure and to be good people. Mm-hmm. That also is a kind of pressure. See,
I find that really the case often in my migraine patients. Is that a type of pain that is also?
Oh, yeah, sure. Like migraine is one of the things. You talk about back pain, but indeed, in a divided mind, I've gone much, much broader than back pain. It's, first of all, pain of all kinds. First, and secondly, it involves a whole variety of other physical disorders that I think stem from the same basic psychology. The common reflux, for example, or irritable bowel syndrome, the common headaches and migraine, among them, of course, common skin reactions, common allergic reactions. The amazing thing
even autoimmune reactions you talk about as well.
Oh, yeah, of course, autoimmune disorders, but those are more serious. I'm talking now about the relatively benign ones, and the pain things fall into that category, and all these other things that are virtually universal. We're talking about the human condition. We are all striving to do right and to do well. We all face problems in our lives. And the point is that it's normal for us to have reactions inside to these pressures and problems in our lives. And what has happened that people will get these physical things, and the entire attention is put on the disorder itself. If you've got a stomach problem, you take this medication. If you've got that problem, you take that medication, and so on. And no attention is paid whatsoever to the fact that these things are initiated by the fact that we are human and that we react to things in life and that we have certain tendencies. The great paradox is that trying to do the right thing and trying to be a good person can be one of the most important factors here. I had a lady tonight.
Can make things worse.
Yeah. A lady tonight in the meeting who we said, you want case histories. She was talking about the problems in her family amongst her sisters and so on. And she said, and I try to make everything good. I try to patch up and be the peacemaker. Well, if I tell you that indeed is the major reason why this poor lady has been having back pain, because all of these pressures that she puts on herself actually produce internal reactions.
Pretty soon you're going to be seeing Secretary of State Condoleezza Rice, I think.
Well, I will tell you, I can't tell you their names, but I have seen
real
secretaries of state in the past. I will tell you that 2 American senators have read one of my books and gotten over their back pain.
Well, that's really amazing.
It's the one you mentioned, healing back pain.
But, this is just mind-blowing to a lot of people, is when people come to you with serious back pain, you don't touch them, manipulate them, you don't inject them, you don't even give them prescription medication to heal their pain. You just talk to them.
First of all, I examine them very carefully.
Yeah.
To make sure what's going on physically, because very often these pain disorders will produce real weaknesses. For example, a lot of people have foot drop as a result of this disorder. Right. Well, invariably, the foot drop is blamed on the herniated disc that they found on the MRI.
So they get leg lifts or shoe implants and things like that?
Or they get surgery for the foot drop. I think it's important to mention that the only reason I've been able to proceed with this work through the years is that when I started many, many years ago, I said, gee, maybe this is not due to the herniated disc. And then I would treat the patient, and they would get better. Mm-hmm. So I had proof that it wasn't the herniated disc. And, of course, that has gone on and on over the years.
Has this made you perhaps a little bit unpopular? Because you work in a hospital, really makes its livelihood from the modalities that they offer.
Well,
and you're a voice basically saying, don't bother with that because that's not really where it's at.
First of all, nobody really feels threatened by me. Let me tell you one of the interesting and very, very sad facts as to why they don't feel threatened. Although I think this is extremely common, I won't say it's universal. 90%, 85 to 90% of the people who have one of these things will not accept my explanation.
Okay.
So what does that mean? It means doctors have to continue doing what they're doing.
So there will always be business for doctors.
Yes. Exactly.
No matter, you do not threaten the medical paradigm. You can help a few select people who are open to your message, and who can do the type of change work that's necessary to overcome their pain.
That's right.
So this is not for everyone. It's kind of like, how many Dr. Sarnos does it take to change a pain patient? And the answer is only if they're willing.
I have to tell you something that's very interesting in that regard. There's a doctor in Arkansas who came to see me many years ago. He's an orthopedic surgeon. And he tried to treat people with pain, and he was never successful. And then he read my books and so on. And he came to see me and spent some time with him. He went back to practice in Arkansas, and he says, whenever he makes the diagnosis, he tells the patient what he thinks, and if the patient accepts the diagnosis, he treats him for the TMS. And if the patient doesn't, he said, I treat him the way he wants to be treated.
I can understand that because, what are you going to do? If the patient doesn't accept that is a pathway, you do the next best thing, which is to do surgery or give them medication or relieve their pain in the best way possible because they're not open to this more comprehensive treatment modality. So when we return, Dr. Sarno, I want you to develop the theory of TMS because TMS is
good. I think I should. That's right. People should know exactly what we mean by this and what happens in the body.
All right, we're gonna review the syndrome that is responsible not just for back pain, but for a vast array of pain problems, including fibromyalgia, carpal tunnel syndrome, and many bodily afflictions. Our guest is Dr. John Sarno. He's author of a dynamite book that you should get called The Divided Mind. I'm Dr. Ronald Hoffman, and this is Health Talk. Back to Health Talk. I'm Dr. Ronald Hoffman. We're talking to Dr. John Sarno, one of the most celebrated but one of the most controversial figures in the field of medicine because he challenges the current medical orthodoxy that bases its treatments on suppressive drugs and surgery, especially to treat pain problems. He's got a comprehensive theory that describes how the mind can actually cause physical changes in the body that lead to chronic pain syndromes. The theory is about TMS. Could you explain it? Not PMS, but T.
T as in Thomas.
Right.
Yeah, T stands for tension. I gave it this name years ago, and the tension I meant to refer to the psychological things. The M, and now this is controversial. As a matter of fact, I have to tell you something interesting. Even in The Divided Mind, that last book, I called it myositis, which means something happening to the muscle. Myo is muscle. Because when I started this work many years ago, I thought that muscle was the only tissue involved. It turns out now that we find that nerve structures, spinal nerves are probably the most common, are much, much more commonly involved. So very recently I decided we should call this the myoneural, tension myoneural syndrome. And syndrome, of course, is the term that applies to anything in medicine. It has many, many manifestations.
So you say in the book that you can actually measure changes in blood circulation and oxygen levels in tissues that are affected by this.
Oh, no. I can't do the measurements. Actually, certain studies have been done in the medical literature in which they did do the measurements.
Okay, but you're not doing it. You don't have a meter that you can do this.
No, I don't have a meter. But what I do, what I assume is based on the symptoms I'm finding, both what the patient complains of and what I find on physical examination, it tells me which spinal nerves, and I'm using that because that's far and away the commonest manifestation now, which spinal nerves are involved. Now, here's what happens. As these spinal nerves peel off the spinal cord, let's say in the low back, as they get out into the soft tissues, that's where I think the brain will reduce the blood flow just a little bit. Not enough to really damage the nerves, but certainly enough to cause dysfunction. And that reduction in blood flow means a mild oxygen deprivation. So in other words, we're seeing symptoms as a result of mild oxygen deprivation to spinal nerves. And that's why the pain may be in the low back, it may be in the leg, because these spinal nerves are all going into the leg, and then we've got a set up in the neck that are going into the arms and hands.
Now, I'm going to be the devil's advocate here, because the psychiatrist would say, great, we believe that stress is a big factor in disease, and what we just need to do is identify these patients. Many of them, they're depressed, they have anxiety. Let's give them Prozac, Zoloft, Ativan, Klonopin, medications that will calm their mind, and their pain will go away. What's wrong with that approach?
Couldn't be anything more wrong, because in fact, depression and anxiety themselves are the result of these unconscious phenomena that are going on. When you give patients, well, certainly if you try to do that, and doctors have done this over the years, they've tried these drugs on patients with pain problems.
And in fact, many patients they're on 5 or 6 different drugs.
Oh, sure. No, actually, the problem is that the drugs, if we're talking about depression, we'll certainly deal with the depression, but that's just changing the chemistry. The depression itself appears to me to be due to the same underlying unconscious things that are causing the pain. I call depression and the pain of these things sister and brother. I call them equivalents of each other. And I've seen this in patients. You
actually have accounts where in getting rid of the pain for some patients, they develop tremendous anxiety and depression.
Exactly.
Because you use a great term in the book. I've really picked up on this. It's called the symptom imperative. Can you explain what that is?
I'm glad you did. You see, when the brain decides for our protection, and I have to keep repeating that, for our protection, that some sort of symptom is necessary, if you take that symptom away in a way that's specious, that doesn't really deal with the underlying problem, the brain will simply give you something else. And I see that all the time. And that's why we call it the brain will not be denied. Unless you deal with these things properly and appropriately, the brain will simply give you something else.
Well, this is a real fundamental challenge to our current medical paradigm, because what we do is we look at specific conditions, and if you have one problem, you go to one doctor. The doctor fixes the problem. And you might have an operation for, say, carpal tunnel syndrome or hip pain, a knee replacement, back surgery, and then you might manifest with another problem. You might develop gastroesophageal reflux. You go to the gastroenterologist. He'll give you an acid blocker, and on and on and on. You could have a whole lifetime portfolio of medical ailments.
Let me say this, that when these other things occur, and I'm glad you mentioned the gastrointestinal things, it is appropriate for a doctor to treat them with medications, but what they don't do in addition is to say, but it's important for you to understand why you got this, what it means in your life, in your psychology. And that we don't see, unfortunately.
Well, where does it stop, though? Because at some point people are going to say, look, Americans eat a lot of junk, they're overweight, they don't exercise. Surely these are factors that contribute to pain and discomfort.
Yeah, well, of course, there's no question about it. And the thing that I complain about, and as you probably know from the book, there are no studies done that consider the emotional factors as one of the risk factors. Sure. You're talking about cardiovascular disorders. There's no question that diet, exercise, cholesterol, and all of those things are important. But you don't have the NIH studying the possible effect of powerful emotions. And that's what I say is lacking, grossly lacking in American medicine.
And maybe because there's no modality that handles that, there's no payoff, there's no cure available.
Well, yeah, that is one of the problems, of course, with the pain. Pain treatment has become a major industry in the United States. And, of course, there isn't much impetus to try and look further into the problem.
You actually say in the book that certain ways of treating pain, showing a patient an X-ray and saying, look, this is where your pain is coming from, or giving patients, say, special orthotic supports in their feet, may reinforce the pain, make the pain worse. How does that happen?
Well, sure, because the patient says, well, I've got this structural abnormality. And, yeah, we're going to try to do something about the structural abnormality, but the pain continues. In fact, one of the jobs that I have to do with some patients is to say to them, now, look, we're in an entirely different ballgame here now. Your herniation, your herniated disc is not causing the pain. You've got to stop thinking about that. You've got to forget what your MRI shows and listen to what I'm telling you about what is really going on in your body.
A lot of patients become virtual cripples. They avoid certain exercises, they take to bed, all of which doesn't help.
Oh, yeah. This is what's so sad about the whole thing.
Actually, you point out a study, very interesting study, that looks at two adjacent countries. One, I think they were in Scandinavia, and one was the former socialist country.
It is Norway and the Lithuanian.
Norway and Lithuania, where they had one country had elaborate legislation that helped people get insurance compensation for whiplash. Right. The other country, they couldn't care less because there was no government support or insurance support for it. What was the difference in the statistics?
There was no incidence of whiplash in Lithuania. And in Norway, it was epidemic. That's what made these doctors travel over to Lithuania to say, gee whiz, maybe it's because we have this easy availability of good treatment that's helping to spur this thing.
We're in effect reinforcing disease by creating categories, names we now show on TV, new ailments that people can identify with.
Yeah, exactly.
We teach people to desire knee replacements, hip replacements, and maybe this is driving the pain industry.
Well, there's no question about it.
All right. When we come back, we'll talk about what the actual process might be to address a complex pain problem, the kind of thing that Dr. John Sarno does on a daily basis and has for decades with thousands of patients that he's treated for various pain syndromes. His latest book, The Divided Mind, lays it out. I'm Dr. Ronald Hoffman, and this is Health Talk. Back to Health Talk. I'm Dr. Ronald Hoffman. We're with the fascinating, always controversial Dr. John Sarno. He's written a new book called The Divided Mind. It's his most ambitious book so far because it tackles not just back pain, which he's famous for treating. He's relieved the back pain of literally thousands of patients with his methods. Now he's extending it to all manner of mind-body disorders. And what are some of the conditions that are amenable to this approach besides back pain?
Yeah, and you say amenable, it really works, because I've had patients who come to me for the back pain and then they've had other problems. For example, a physician I saw not too terribly long ago was having terrible problems with allergies every springtime, and I told him when I saw him, now, we're going to work on this, and what I want you to do is to put that allergic thing into the same bag with your back pain, and the next spring he had nothing. So common allergies fall into this category, common gastrointestinal things, the stomach, the irritable bowel syndrome, common skin reactions, headaches of various kinds. Now, you understand, I expect all of my patients to be thoroughly studied before I see them.
Right, because God forbid you might. I mean, there are organic problems. You can't say, well, I'm going to cure an obstructive colon cancer.
Yeah, it would be irresponsible of me to take them on and say, oh, your headache is nothing, and it turns out to have a brain tumor.
Right.
So, but these are common things. Urinary tract problems, for example.
Like urinary frequency, unexplained origin.
Extremely common, exactly. And so it became clear over the years that these things are all reacting to the same psychology. All right, you said, how do we treat them?
Yeah, like what is it like, nuts and bolts? Somebody comes to see you, they sit down, present their case. What do they have to do?
All right, I examine them. And in that first session, I have to have a prolonged session with them at the beginning. I explain to them after I've learned, what their lives are like and what they're like, what the psychological factors are that are at work. Then what I do is to educate these folks. I start the education in that initial...
Sometimes you do that in a group setting as well.
Well,
right?
Yeah, of course. For example, I will start the process in my office when I see them, and then once a week I meet with all the new patients I've seen that week, and I lecture them for 2 hours. And, of course, you can do that because even though the details are different in different people, the same basic things keep coming up. They put themselves under stress. They expect too much of themselves.
Is this due to the power of your personality? You're a very persuasive guy. Is this something generalizable, or other doctors practicing this?
No, it's certainly generalizable.
Okay.
Certainly I do it very well. But it can be done by others. And there are doctors, a handful across the country who do it.
And actually there's several other authors in the book, which makes it interesting because you have a part in the book, and then there are a couple of other chapters. There's one good chapter on hypertension. There's a rheumatologist writes a chapter in the book about his experience. There's a general internist. So there are other practitioners of this across the country.
Sure. There's a family doctor. There's a non-operative orthopedist. There's an orthopedist.
Wait. That sounds like an oxymoron. A non-operative orthopedist.
Sure.
That's like an honest politician or a virtuous prostitute. How does that happen? You mean he has found this so successful that he doesn't operate anymore?
No, actually he never did, even before he started to work with me.
Okay.
He tended to treat people with conservative measures, and then, of course, when he started... remember what I said, not everyone will accept this diagnosis, so he still has to do other things with them.
Okay.
Yeah.
All right, we need to take a break. When we come back, let's elaborate on the way you treat patients suffering from TMS. The book is The Divided Mind. Our guest, Dr. John Sarno. This is Health Talk. Back to Health Talk. I'm Dr. Ronald Hoffman. Our guest tonight is controversial physician Dr. John Sarno. He's written a great new book called The Divided Mind. I recommend it highly. And in the concluding couple of minutes we have, a lot of people are going to hear this, and a lot of people are going to read your book. But not everybody has access to you or to a physician who embraces this therapy. Are there things that people can do on their own to transform their pain syndrome, or at least begin to address it?
Yeah, well, that, of course, is a great, great problem. And this is why my books have turned out to be helpful in that regard for people not here.
Can people actually read the book and improve their pain?
Yeah, people do. I mean, for example, I had an email from an attorney in the Midwest not too long ago. As a runner, he'd been troubled with his back pain for 2 or 3 years, and he couldn't get over it. He read the book, and he took very seriously what I said, and by gum, his pain went away. And he sent me this email, and he said, I can't believe it. And you see, that's one of the things that's remarkable about this disorder, and that's what I do. I actually treat patients by teaching them what's going on. And you say, well, how is that a treatment? Well, I don't know. You tell me. This is what the brain does. By learning what's going on, this actually has the ability to stop the symptoms.
Are there specific techniques like journaling or writing some of these things out? Yes,
writing, yeah. Actually, I'm so glad you mentioned that, because writing turns out to be extremely important. And what I tell my own patients to do is make a list of all the things in your life that are problematic, and also be sure to include your own tendencies and write about them. Write a lot about them. And it's amazing how that will very often be. I really use it in my day-to-day practice.
It's almost like release of a pressure valve that helps to relieve the pressure of these negative emotions on your pain syndromes.
Well,
this is a fascinating book, and I think it's going to initiate a lot of controversy that is really needs to be aired, because we may be taking a wrong turn in medicine by not addressing the mind, as is suggested by tonight's guest, Dr. John Sarno, a revolutionary physician. Congratulations, Dr. Sarno. Great book, very important life work. We really admire what you've been up to. I'm Dr. Ronald Hoffman. Thanks for joining us. This is Health Talk.
I've got one that can see.